nature and cause of a sprained ankle. A sprained ankle is a stretching or tearing of ankle ligaments which support the joint by connecting bones to each other. Signs and symptoms will vary depending on the severity of the injury and may include pain and swelling. This can stretch or tear the tough bands of tissue that help hold your ankle bones together. Ligaments help stabilize joints, preventing excessive movement. A sprained ankle occurs when the ligaments are forced beyond their normal range of motion. How to assess a sprained ankle. When having a sprained ankle, you should go to the doctor and see how severe the injury is based on the amount of swelling, pain, bruising, and stability. If you have difficulty bearing weight or tenderness in the bones of the foot and ankle, you may need additional tests to rule out a fracture. How to manage a sprained ankle. Over the next 24 to 48 hours following the sprained ankle, pull your ankle on a pillow instead of letting it rest on the ground whilst you sit on the couch. This helps reduce swelling and inflammation. And to manage a sprained ankle, step 1, you should stop the activity, rest the joint ankle, use ice packs every 2 hours and apply it for 15 minutes. Bandage the joint firmly and extend the wrapping up the calf and down the foot. Raise the ankle above heart height whenever possible. The purpose of rehabilitation procedures is to ensure that athletes who return to play do so only when they are ready and it is safe to do so. If athletes return to play too quickly, they can increase the chance of re-injury. You should loop a towel around the ball of your foot, slowly pull back until you feel a stretch in the lower calf and heel. Once you can stand, try placing your injured foot around behind the other with your toes pointing forward. Keeping your heels down, slowly bend your back knee until you feel a heel stretch in the back leg as shown in this photo. Heat and cold should be used when athletes have sprained ankles. Heat should be applied after a couple days when the swelling has gone down and the pain is at minimal. Heat opens up vessels to promote blood flow and stimulates healing of the damaged tissues. It can ease pain and improve stiffness before activity, whereas ice should be used to minimize swelling for the first 2 to 3 days. After this period, heat can be used to increase blood flow and assist the natural healing process. Applying heat too early may cause additional swelling by increasing blood flow to the injury, which causes the volleyball player to take longer to heal. You should use ice packs every 2 hours and apply it 15 minutes. Bandage the joint firmly and extend the wrapping up the calf and down the foot. Raise the ankle above heart height whenever possible. Avoid exercise, heat, alcohol, and massage in the first 48 hours. Types of training for a sprained ankle. Ankle circles. Rotate your ankle in a circle. Ankle pumps. Bend and straighten your ankles. Deep calf stretch. Stand with one foot in front of the other, holding onto a support. Calf stretches. Heel raises. Calf stretches. I already did that. Heel dips and raises, and balance. It is important for athletes to do training as it increases blood flow and circulation, which helps with the healing process. Rehabilitative exercises encourages you to move appropriately, therefore avoiding further injury. Indicators that are needed before the athlete can return back to play. After an ankle sprain, it is important to assess the athlete in straight ahead running and sprinting over a distance of at least 40 meters. You should look for any signs of limping or asymmetry of lower leg function and proceed to put the athlete through an exercise of running a figure 8 around cones. Considerations needed before the athlete can return to play. At the point of return to sport, physiological healing ought to have occurred. Parameters such as pain, swelling, range of motion, and strength should be assessed, and the athlete should have minimal or no deficits. Having had a previous injury predisposes an athlete to re-injury.